My name is Dr. Weisenberg, or Dr. Michael Weisenberg, and I've been practicing dentistry for about 6 years. I've been in general dentistry. I was originally in pediatrics, but been in general dentistry for about 3.5. Started with the occlusal stuff with Spear, and then started getting into implants with other groups, some local, some back on the East Coast, and really started placing implants about a little bit over a year ago. This class was a lot different than I expected. I've taken several implant curriculums and advanced implant curriculums, and I was kind of expecting a little bit more of maybe a different perspective, a little bit, or a different technique, not completely different approach to visualizing and planning out treatment. And yeah, my expectations from this course were already pretty high, but over the next week or so, I'm just going to be digesting so much and implementing it, not just the way that I practice, but how I consider cases and how I set cases up and how I go about approaching people. So over the past 4 days, I've placed 35 implants here. I've also done a sinus retrieval via lateral sinus lift window. And I also did a connective tissue graft and apically advanced tissue around existing implants to correct the patient's smile. I don't really know any other places where I have that opportunity, have the faculty and the staff that have the faith in me and who've given me the support and guidance I needed to be able to do that. So Dr. Brown, Dr. Chaffin cover a lot, but I think the part that really shocked me the most is I do a lot of overdentures and I've gotten into hybrids, but I never really, in all the other courses I've taken, the biggest thing that they tell us, or one of the biggest things that dentists make a mistake about, is not reducing enough bone. And as a dentist and as a dentist who does implants and restorative and all these other things, I'm always trying to preserve the bone. I mean, we're peri-probing all the time. We hate it, but it's because we're trying to preserve bone. So just innately, the idea of just whacking away all this bone to get a flat ridge in order to get hybrid on, I understood the need for the restorative spacing, but I didn't really understand that there were other options. And to see that we can get not only as good but better results with implant bridges, full span, with beautiful gum contours, I can just picture in my mind my patients who have the hybrids, when they go to that real exaggerated smile, you can see that transition line. And so in some of the post-ops and looking at the patients here, you would never be able to tell. That's a full arch bridge. I didn't realize that was an option, and it's not one that's really taught that much. Like, I've taken a lot of all on X cases, a lot of courses, and that's why I was kind of mentioning, it's making me rethink the way I approach cases and treatment plan, and thinking about, hey, is their bite collapsed more? Can I open that up? And that's what I kind of expected. They're going to say, like, well, the bite's collapsed, so they've worn the teeth down, so you're going to open up a little bit, so maybe you save 3 millimeters of bone. No. The difference is like 10 millimeters. Because when you're looking at a full hybrid, you're looking anywhere between, for that inner occlusal space of just one arch, you're looking for anywhere between like 17 to 21 millimeters. But if I have a bridge, I just need 9. I mean, and let's say it's a younger patient who in their 30s are getting this. What is that bone going to do over time? Yeah, I mean, we have implants in it, so it's going to hold bone, but now they just have so much more. So if there's ever an issue, we can really navigate that and give them a really good long-term prognosis. And it's maybe reflect back on my other cases, thinking, like, with this bone that I've whacked away, have I really put my patient at a deficit? And I mean, you only know what you know. But yeah, I mean, I took that to heart. So after this course, I think any of the docs are ready to place either buried or immediate implants, delayed or immediate. But the techniques that we learned here, from even just the way that we're doing our osteotomies and creating that reservoir so we can crush bone in there and get really, really good primary stability without not being able to go any further and strip the bone away and get stuck with that implant. We've all been there where we're stuck with that implant 3 or 4 millimeters above where we want it to be, and we can't get it to go down anymore. And I mean, they show us how to avoid that. And if you have that issue, how to resolve it every time. That's a game changer for me, because I like predictability. So I've kind of shied away from immediates, but with the techniques that we learned here, it was, like I said, it was a game changer for me. I've been to several other implant courses, multi-course curriculums, all the different ones that you've heard of. I mean, not all of them, but a good number of them. Kind of a CE junkie. The atmosphere here, it was jovial, like some of the other ones, but the difference with this was the one-on-one detail, the one-on-one guidance. You were never just put off with a past grad who may or may not know exactly what he's doing if things get complicated. And Dr. Chaffin and Dr. Brown, if you turn around, they're over your shoulder. Not because they're worried about you, but for that positive support and that guidance. And even when there is an issue, it's never you messed up, step back, let me get in there. They have the self-control and the confidence and the ability to communicate that really sets them apart. They're not just good clinicians, they're good educators. And that's one thing that we desperately need within dentistry. Because just because you can do something really well doesn't necessarily mean that you can explain it well. When you go to these other implant gurus, sometimes they're not as approachable. Sometimes they have a very set curriculum and they don't want a ton of questions. They'll take questions, but I ask a lot of questions. Not only was that not a bother to them, they said, keep them coming, doc, keep them coming. Even afterwards, after the first day when I took them aside, I'm like, listen, do you want me to just write down some of my questions and we can answer them after that? They're like, no. Those questions are gonna help connect the dots for the other docs. They might not be asking them because they don't know to ask it, or they're not confident to ask it. But not only are they welcoming questions, they're encouraging them. They encourage that interaction. Like when we're sitting here in the conference room and learning these case things, it's not just them lecturing. They'll go over a topic and they start engaging us. Okay, doc, given what you just learned, how would you handle this? Okay, and then they switch it up. Go to the next doc. Okay, now how would you handle that? What size implant would you do here? Okay, this implant's torqued out, how do you solve that? And so you took that passive learning style where you're listening, and now they switch it over to an active learning where you're having to process that information and answer questions. And that's something that I haven't really had at other courses, either because we're on too much of a time crunch or because it's too big of a group. Here, it was the difference between being in a classroom and being with a tutor, if that makes sense. It's one-on-one. They are actively engaged with you. They thrive on you succeeding and learning. You're not just a number. You're not just passing through. They follow up. And when the other students from other courses were coming back just to get more experience, and rather than being like, you know what, to these other past students, just shadow, you can check some things out. No, they threw them in there too. And they didn't just throw them like random cases. They're like, okay, we have a good case for a conversion and you're ready for that. And so they set them up for that. They didn't have to do that. In fact, I'm honestly quite surprised that they do that. But when I'm looking at a course, same way I'm looking at equipment, I'm looking for making sure I get something out of my investment, and that's a worthwhile investment. To see the way that these guys, this team, not only treats their current students, but their former students, it's amazing. I don't even know what else to say about that. It's totally unique in my experience. I would absolutely recommend this course to my friends, any new docs, and this is the part that surprised me the most. I've sent messages to some of my other former teachers who taught courses to say, hey, you gotta come out and see, like, it's not just to place a different style implant, it's how to visualize things from the start and come from a restorative aspect. And this is actually one of the bigger things I wanted to kind of highlight with this course. Usually in these types of courses, we think a little bit about the restorative, but it's really about the surgical. That's not the case here. And like we've all been trained, you start with the end in mind, you go backwards. That's truly how it is here. I mean, Dr. Chaffin and Dr. Brown are excellent restorative dentists. Excellent. It's unbelievable, to be honest, the quality of cases I'm seeing coming out of here. And to have that type of guidance that takes you forward to the final stage and goes back and shows you how to plan that accurately, that's not anything I've seen in a different course. If you want to learn that part, you gotta take the next lesson. It's quite unique.